Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Well, welcome back to Insurance Matchmaking by myself here today. Still fighting off the cough from the cold I had a couple weeks ago. It's just frustrating because the cold will go away right away. The sneezing, the itchy nose, itchy eyes, runny nose, that all goes away. But I just can't seem to shake the cough, and so I'm still kind of dealing with that. So I'm sucking on a cough drop and got my coffee here. Hopefully I won't. And the good news is this will get edited, and so a lot of the coughs will get edited out anyway. So the last couple weeks, you've probably kind of getting to know Elijah a little bit. He talked on the radio. We'll probably get him on here again. And if you had tuned into those previous episodes, Elijah Ridley is now a new agent with Matt Libby Insurance, and I've known Elijah close to 10 years. Not quite 10 years. He just is having his 10th anniversary with his wife. So he was already married when I met him. So I know it hasn't been 10 years yet, but it's close. And when I met Elijah, he was working for Express Employment, and he helped me hire my first part-time office assistant. And it was ironic that he and I got together and decided that he wanted to work with me right after I hired somebody else through Express. So he's doing a lot of training. I'm going to have him back on after we never complete our training, but he's working on certifications. He's working on the infamous AHIP right now, which is the test we have to take every year to be certified to offer the Medicare Advantage plan. So he's working through that, been listening to some podcasts. We went over a bunch of stuff yesterday, is kind of explaining my quoting process out, when I compare one Medicare Advantage to another and why I maybe recommend this plan over that plan. Explaining how the give back plans work. So just a lot of that general knowledge that I need him to know, but I needed to get through that AHIP first, and then we get the carrier certifications going, and he'll be ready to sell when October 15th hits. Hopefully even before that, before the end of this month. But kind of wanted to just touch base on that and talking about the enrollment time. It's September now. And so once I hit September, my mind's really getting fixated on the AEP, the annual election period for Medicare Advantage. And I stress that it is for Medicare Advantage and the Part D prescription drug plans. Again, if you have a Medicare supplement, you can change it at that time, but there's no guaranteed issue because you're changing during that enrollment time. You can change that Medicare supplement anytime, but the drug plans and the Advantage plans is what's critical, and especially this year, again, the drug plans. It's really going to be important to verify which is the right drug plan for you. A lot of them, the premiums are going up. Some of the plans are being phased out, and so you need to be watching for mail from your insurance carrier. Now, you're going to get a bunch of postcard type stuff, and most of the stuff that's in kind of a postcard format, or important open now, it's just going to be solicitations to try to get you to call a number, get on their list so that when October 15th rolls around, they can enroll you in their Medicare Advantage plan. But you should get a letter from your insurance company, and it's going to be I don't know what they call it, the number 4 envelope. I always forget. It's the one that's if you fold it over a sheet of copy paper from top to bottom, bottom to top, in half, the envelope's about that size. That's going to have your annual notice of changes in it. And they may say that on the outside of the letter envelope. I wish they would. But that is really official mail. That is the one piece of mail that you get during this Medicare season you really need to open because it's going to outline everything that's changing with your plan. And for some people, that change is going to be your plan's no longer available. Now, they do have set up some things where they do what they call crosswalk, and they crosswalk you into a different plan. That might not be the perfect plan for you. And I say that because some of the plans, you got the plan because it was inexpensive. And some of those plans are being eliminated. So they're going to move you to another plan that is more expensive. Now, it doesn't mean it could end up still costing you about the same overall for the year, but that monthly premium is going to go up. So that's one of the things you want to double check. I've been going to a lot of different meetings. We're looking at some of the kind of the advance view on some of the plans. I think I can get away with telling you this is there will be more than one Part D prescription drug plan that has a zero premium. I can't tell you who it is, but if you currently have the zero premium plan and you're not happy with that company, you don't have to stay with that company just because they have a zero premium on your drug plan. We can help you get to another one. Unfortunately for me, that's still going to be another one of those drug plans that doesn't pay me any commission. We'll be helping you to that plan as a courtesy, not as something that's going to earn us some income. But we're going to be getting at that link to that form. The program is called Retire Flow, so it's going to say like app.retireflow.com/ and then my name, something like that. I think it's a link. But you go to that, you fill that out. It's going to ask you your prescriptions. It's going to ask you what doctors you see. Now, if you have a Medicare supplement and you're just wanting to check your prescription drugs, you could skip the part about the doctors. It's not going to matter. But if you fill it out, it doesn't matter either. It's good information for us to have just in case we do look at, maybe we should consider the Medicare Advantage plan this year. Then I really need to know who your doctors are, because that's what's important when it comes to Medicare Advantage, besides your prescription drugs, is what doctors are in network with that plan. Now, the good news around here in our area, the hospitals are pretty much in network with every carrier. There is one carrier that is not in network with Cookeville Regional, and it's one of the reasons why I actually can't offer that plan in Putnam or White counties because of the hospital not being in network. But surrounding counties, Jackson County, Cumberland County, Wilson County, that plan is available. So we have to be a little careful, because what's happening there is a lot of the local doctors aren't in network with that plan because the hospital's not. And so that since that plan isn't being offered in Putnam County yet, there's a lot of local doctors that might not be in network with that plan. And that's the same with all the plans. The good news is the hospital's in network with pretty much all the Medicare Advantage plans, and they're in network with all of the ACA, Affordable Care Act, Obamacare plans. So the hospital part, you're good, but generally we still need to kind of double check on the doctor to make sure they're in network. So those are some things we need to check with those Advantage plans. And then the last part of that Retire Flow form is what we call the scope of appointment. CMS says I have to have that permission slip before I talk to you about your Part D or Medicare Advantage plans. And it also asks to say, hey, is it okay to talk to you about other health plans like dental and hospital plans and cancer plans? So we always ask everybody to go ahead and or to ask you to initial the 5 box at the beginning of that form. Please go ahead and initial them all. Even if you think, I only want to talk about the drug plan, go ahead and initial them. Then I'm legal to talk to you about the other plans that might affect you. So that's one of the things I wanted to be sure you're kind of aware of. Like I said, we're going to get those links out to our clients. If you go on my website to click on the link to set up an appointment, if you click on the link if you go to the Medicare appointments, there's a little kind of an instruction section. And if you scroll down through into that instruction section, there will be a link. And I do believe, I think I've got it set up also that once you set up that appointment time, when it sends that confirmation email, I think the link is also going to be in that email. I got to double check that. If it's not, I'm going to need to do that. That just kind of remind you, hey, did you fill out this form when you booked your appointment? If not, please fill that out now. And that's going to help us to know what plans you have. Because one of the things we're going to do, we can put those prescriptions in those doctors and have those in our database to know that we have that information. Because on October 1st, we can shop the plans. Now, you can't sign up for anything, so probably more than likely what I'm going to do, be spending that time doing, is going and looking up the different options for each person for that time frame. And I think, depending on what I'm recommending, I think I can email the quotes to you to look at. Like if I'm comparing this plan to this plan and say, okay, here's the plan you have. This is the plan I think might be a good solution or option to change to, and then and let you look at that, and then on October 15th we can go, okay, click, put in your information again, do an electronic signature, and you're done with the enrollment season, and you can go and enjoy the rest of the fall and not be worried about your Medicare because you've already taken care of it. You can not answer the phone when you see those unknown numbers and just know that's somebody trying to sell me Medicare. I'm not going to answer the phone. Or if you do, thinking it's somebody else calling you, and you find out it, and you can say, hey, I've got my local agent. I've already taken care of that. Boom, and move on. I always try to tell people, don't give out any information to people that are calling you on the phone, even if they think, we can get you a better plan. I had a client recently on a plan that was the best plan available for her at the time. One of my East Tennessee clients, she has the doctor at Summit Medical Group, so pretty much Blue Cross and Humana were her only options. And she had recently lost her Medicaid status. So she no longer had the special needs plan, so she had to have a plan that had copays and such, and she didn't have the food card anymore. And she called one of those 800 numbers, and they moved her in. I don't know if she called Humana and did, but they moved her to another plan that it's probably. And my guess is they moved her to the zero premium plan, which she already had a zero premium because she still had the low income subsidy for her Part D, but she's going to have lower max out-of-pocket, lower hospital copay on the plan that I put her on. So it's not going to cost her any more per month, but it's going to cost her more now for her medical care because she thought she didn't have all the benefits and she called somebody else. So I just strongly encourage everybody, whether you're my client or not, if you've taken care of your Medicare and it's one of the other local agents in town, believe it or not, I'm not the only one, but as far as I'm concerned, I'm the only one you need to work with. But if you're already working with somebody local and you're happy with what they've done for you, don't call those 800 numbers. Their entire goal is to switch you to another Medicare Advantage plan so they can get paid. Even if you're not on a Medicare Advantage. If you're on Medicare, they're going to try to put you on a Medicare Advantage because that's how they get paid. You can't get extra dental. You can't get a food card. You can't get free transportation without changing the plan that you have. All those things are out there. And so if you're calling to get extra benefits, the only way you get extra benefits is change your plan. You can't add extra benefits to the plan you have. Now, we have supplemental plans that help fill some of those gaps of your plan, but none of them are going to be free. So if you're calling for something free, you have to change your plan to get another free benefit. You can't just add it to the plan you have. So it looks like we're up on the break here, and we'll talk a little bit more after the commercials.
Big news coming from Twin Lakes. Introducing Tri-Lite Mobile, your new wireless solution for the people who bring you better internet. Get started with plans that begin at free. Yes, your first year of unlimited service is on us when you upgrade or sign up for Twin Lakes Internet and enroll in auto pay and paperless billing. Bring your own device or choose a new one and keep your same phone number. Enjoy nationwide coverage, local service you trust, and budget-friendly options that fit your life. Call 931-476-2355 or visit twinlakes.net to learn more. Some restrictions may apply.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, welcome back, and please participate with our local sponsors and keep your business local. Kind of goes back to what I was saying before the break. Don't call the 800 numbers toll 800. We're so used to saying 800, some of them are now 855-866. But anyway, those toll-free numbers, looking for an extra benefit. I'm going to try to get you on the plan that has all the best benefits. I think I may have mentioned this recently. I had another client that got convinced, he's going to get $100 more benefits each month. Well, yeah, he was getting $100 of over-the-counter benefits that weren't on the plan that he had because he had a plan that had a $105 Part B give back. He was actually getting $100 each month. It increased his Social Security check. He says, I don't really use those over-the-counter benefits. Yeah, and I can't switch him now. We have to wait until the annual election period to switch him to a plan for next year. It goes back to, I keep stressing, don't call those out of town, those toll-free numbers because you think you're going to get something extra. If there was something extra for you to get, I'm going to make sure you have it. And with that being said, there are some plans this year. A lot of companies, and I think I can say this again because I'm generalizing, a lot of plans are going to what they call the C-SNPs. And I know we call the special needs plans, we call them SNPs, SNP, so we call them SNPs. And then we have what's called a C-SNP. It's a chronic special needs plan. And those chronic special needs plans relate to maybe you have heart disease, or you have diabetes, or you have COPD, and there's a couple of different heart conditions that will fall into the what they'll cover. And the neat thing with those plans are those do give us, if you are not on a chronic special needs plan now, you have an ongoing special enrollment period. You can pick up one of those special needs plans again during the other times of the year. And what you do on that, you sign up for that plan, and then there's a confirmation process that and the company general will reach out to them, but it never hurts to go ahead and try to contact your doctor, because there's like a 30-day period that your doctor has to confirm that you have the condition that qualifies for the special needs plan. And the reason I bring that up is a lot of those plans will have some extra benefits. Most of those plans are going to have a food card. So if you have a chronic condition like diabetes or COPD, those are plans that are going to probably qualify for the food cards. The used to be everybody that had the what we call the dual special needs plan, because they're low income. Those plans generally will still come with a food card, but you have to have certain health conditions to qualify to get the food card. So just having low income doesn't automatically qualify. That's a model that changed, and I'm not going to go in deep into that because it confuses me when I look at it. But just knowing that a lot of plans that maybe we're offering food cards are not going to, or if they do, there's an extra hoop you have to jump through to qualify for that special needs. But if you qualify for one of the chronic special needs plans, you have the health condition, one of the health conditions that will qualify you to have a food card. So those plans are going to have some generous over-the-counter, generous food card benefit. Some of them really, some of them they're not going to have the Part B give back on those plans, but they're going to help out a lot. Your maximum out of pocket may be lower. Some of them are going to use what they call a tier 6 on your drug formulary. And as I was talking to somebody yesterday, tier 6 is the exception to the rule of the higher the tier number, the higher the cost for your prescriptions. Tier 6 is actually going to have a lot of either very low cost or zero copay prescriptions. And again, it's going to be, some of it is going to be because you have that chronic condition. You might have one drug that would be tier 2 for anybody else, but if you have the chronic condition, it's going to be on your tier 6. So they may still have like a $10 copay, and then you're going to have a zero copay, for example. The other thing is a lot of the companies are doing they have to have that capped insulin at $35 a prescription, or $35 a month on your month's supply. So a lot of companies will put their covered insulin on the tier 6. And so which normally would be like on tier 3, and it would have been a $40-some copay subject to the deductible. And that brings me to the other topic I wanted to remember I covered, the Part D deductible. As I've mentioned, currently it's $590. It's going to be $610 next year. And a lot of your Medicare Advantage plans are adding a drug deductible to their plans. Now, not all of them are going to go to that $610, but some of them are, it's going to be maybe $200, some of them $400, but it's going to apply to drugs on tier 3, 4, and 5. The other one was the other one I believe I saw was the tier 6 wouldn't apply to the deductible, but the deductible would apply to everything else. It's kind of weird. But you'll also see plans, especially when you're looking at a Medicare Advantage plan, and it's got some great copays. And then you look at the drug coverage, and it has the $610 deductible, and it applies to all tiers, even 1 and 2. And the reason for that is that plan is really designed for people who have that low income subsidy, because they don't have to pay the deductible and they have reduced costs on their prescriptions. So they get to and that plan's usually going to have a premium $20 to $30. Again, that premium is for the Part D portion of the plan, and for those with the low income subsidy, or also called extra help, that covers that premium. So it covers the premium, it covers the deductible, and they're paying reduced prices on their prescriptions on that plan. If you're not taking any prescriptions, like if you were on a Medicare supplement, and you would get that zero premium drug plan because you just don't want to have the Part D penalty, so you have a drug plan, that plan can work very well for you. Just know that if you get prescribed anything during the year, you're probably going to pay full cost for it because you haven't hit that $610 deductible. But the co-pays, the max out-of-pocket, those little things like that on that plan are generally lower. And so it can be a good plan if you're not taking any prescription. Or if you are taking a couple of, like atorvastatin, lisinopril, rosuvastatin, levothyroxine, those are all always, those are always tier 1 on every plan. And if you're going to a preferred pharmacy, they're probably a zero copay, or the drug itself is for a 30-day supply only costs $3 to $5. So you could just buy that. Which brings up another topic. Elijah and I were talking this week. I have one of those savings plans. It's called Bax RX. You can find information on that. You can find information on that on my website, and it's got a couple of different modes. You can sign up. They do have a formulary that all their generics are covered for one price, about a $30 per month membership. And you can pick up your prescriptions at the pharmacy, or you can have them shipped directly to your house at no extra charge. You're just paying that fee, and it's only on generics. Now, if you do get a brand name, what typically would be a tier 3 on a Medicare plan, they do have a discount program, so you can go to a pharmacy and get a discount on that prescription. And the reason I like to promote this Bax RX is, and I used to talk about the yellow card, which is the one most people are familiar with. I'm not going to say the name of it because I'm not going to give them the publicity. But I used to get that box of 500 cards, and that I would send them, that I would give to my clients and everything else for people to take advantage of their savings. The problem is you get into their database, and then some of those obnoxious phone calls you're getting trying to switch you to a Medicare Advantage plan are because you used that prescription discount program, because they are owned by one of the biggest call centers that does the Medicare Advantage call center places. So you're in their database. They can call you, and even if you're on the do not call list, because they have a business relationship with you. So the old saying, nothing's free. There's always a catch. Yes, there's a catch. So if you're using that yellow card, you're going to get solicited by my competition. That's one of the things I like about Bax RX. You use their discount, they're not going to call you. Their mode is to offer you prescription discounts, not to get you signed up. They're working they're working with us as brokers, not working against us. So that's one of those things I hope, and you can get that link on my website, or I'll always reach out. If you go to insurancematchmaking.com, there's the comment section, and you can say, I want to know about that prescription discount program, and then I can get that to you. So those are some things to check on. So like I said, be looking for, that's the other thing I forgot I've covered. I'm almost out of time. As I mentioned, some of the stuff that's coming up is because I'm going to some of the meetings with the insurance carriers. They kind of do their product launch. We call them AEP kickoffs, for us to get ready for the enrollment season. I've got a couple more things coming up. I don't know, depending on when this show airs, it may be afterwards, but I've got a trip to Nashville, doing a couple meetings in Nashville that are not carrier specific, they're industry specific. And then I'm also going to go back to Tupelo for some training on growing my agency, we'll see how that goes. And then the week after I do that, Elijah's going for the agent boot camp that I attended about a month ago. He's going to be going to that. That's going to help get him set for the AEP, because he's going to be brand new to Medicare, and so we're cramming a bunch of training down on him to make sure he is ready to go so he can help as many people as possible, because there's going to be a lot of upheaval this year with the Medicare marketplace, whether it's prescription drugs or whether it's a Medicare Advantage. As I mentioned, a lot of those Medicare Advantage are adding deductible for the Part D, so watch for that annual notice of change. It's September now. Depending on what day this show airs, you maybe already have that annual notice of change. And if you got questions about it, give us a call and we'll go over that with you. Because once you get that annual notice of change, I'm legal to talk to you about the differences on your plan. I can't compare it to another plan for next year, but we can compare, hey, this is what your plan was last year, this is what it looks like this year, or they're crosswalking you to this plan. Doesn't mean that we can't change your plan, because that may not be the best fit for you. And maybe your doctor left that network. So there's a lot of changes that we need to be able to review and go over with you about what are your options for your Medicare coverage. So that's a lot on my mind this time of year. It's Medicare, and I want to make sure I get that out to you folks and reach out to us for help. And if you call, you don't have to just talk to me. I know I'm the voice you hear, and maybe even you're already my client. Give the others a chance to see if they can't help you. Even Amy, who's not a licensed agent, a lot of the stuff, if you're just needing to know, hey, what do I need to do to get my information in, or if you need to schedule an appointment, you can do it online. My calendar, what's really great about the way my calendar online works is you go to that calendar and you find a date and time that works for you. If I'm busy during that time won't show up. So if that time is on that calendar there, then I have an opening during that time. Book your time, and then I'll see you at the office when you come in. And it's going to give you like 3 different options that you can book a virtual online meeting, which we use Google Meet. You can ask for a phone call, or you can make the appointment to come to the office. If you're doing for the phone call, I definitely have to have that scope of appointment form, and the same thing with the virtual appointment. I've got to have that form signed at least 48 hours before we have that meeting. If you're coming to the office, it doesn't have, you can sign it at the office, but it's really helpful if we already have your prescriptions and doctor list, because we can update that. So again, until next week, keep it on Grace 1077. Remember, at Matt Libby Insurance, we can cover you from head to toe. It doesn't have to cost you an arm and a leg, and we'll see you next week on Insurance Matchmaking.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.